Work at Samaritan Health Services, which is not a traditional kind of public health setting. But that being said, the class that I teach is healthcare epidemiology. And so I think it's directly related to my work at Samaritan. So my job at Samaritan as Director for Research and Evaluation involves a lot of supporting Samaritan investigators doing research projects, evaluation projects, but we also do a lot of collaborative research, for example, with other faculty at Oregon State University. And so I think the work that I do at Samaritan is actually directly related to the class that I teach, and that's actually, I try really hard to keep the class kind of as relevant and really reflects the kind of challenges that I'm working through and things that I have learned from the job.
My graduate program, I used like almost every class that I took in my career, and I want to create that experience for students. So, you know, there's assessing, implementation, evaluation, quality assurance. There's a variety of kind of connected activities that students are always going to use in their public health career. The thing that they also learn in the first class, the evidence-based public health one, is how to construct a logic model. And it's really basically just a one-page roadmap of a public health program. And I have to admit, when I first started working on this in my career, I'm like, oh, what is this? This is a waste of time. Why would anybody do this? It's like, I don't know if you have kids or remember these books, the Frog and Toad books, and Frog would say, okay, I'm going to make a list of what I'm going to do tomorrow. Number 1, I'm going to get up. Number 2, I'm going to get out of bed. Number 3, I'm going to put my shoes on. I'm going to eat breakfast. It almost seemed like it's so obvious. Why should we do this? But over the course of my career, I really learned to understand and appreciate how important logic models are, because they really are like a blueprint of a program. So we do that in the first course. And then the second course is a grant writing course. And throughout any public health practitioner's career, they're going to be either responsible for or significantly included in the grant writing process, because that's how public health operates basically. So I try to make the assignments, as from my perspective, as realistic and real world as possible. There's a lot of group work in both of these classes. That's another reality of public health. You're always working with individuals and groups. And so I think it's really important to kind of hone those skills in graduate school. So that's kind of how I deal with that. I try to make it as realistic as possible based on what they're going to be doing when they continue on in their careers.